Hello everybody and welcome to our 18th Mnemonic in Internal Medicine. I greet you in the awesome name of my Lord and Savior Jesus. Yes, it's the eve of Christmas Eve, and previously we've discussed 5 T's of spinal cord issues. Today we're discussing 5 T's of pericardial disease. So, my friend can't decide which video gaming system to get for Christmas. He is inconsolable. And what did Adam say the day before Christmas? He said, "It's Christmas Eve." So, we know that pericarditis describes inflammation of the pericardium, which is essentially the fibrous sac that surrounds the heart. Now, pericarditis is most often an acute process, but can indeed become chronic and evolve into constrictive pericarditis. So, it's a spectrum of disease, really. Acute pericarditis can be so-called dry or associated with the pericardial effusion, and it is associated hypotension that's tamponade. And the size of the pericardial effusion can range from trivial without hemodynamic significance to large and associated with tamponade, right? Symptoms of acute pericarditis include the pleuritic chest pain, non-productive cough, hiccups, and odonophagia. Physical findings of acute pericarditis include fever, pericardial friction rub, that scratching pericardial friction rub, which is basically a high-pitched scratchy sound that may have 1, 2, or 3 components. ECG findings of acute pericarditis include diffuse ST segment elevation, diffuse PR segment depression, and PR segment elevation in lead AVR. So be aware of those. For more information on pericarditis, please review my video on the algorithm, an algorithmic approach to pericarditis. Okay. So today we're talking about the 5 T's of pericardial disease. So the first T, as a differential of pericarditis, is TB pericarditis. So clues with this, usually the patients are immunocompromised. So sometimes not necessarily so, but many times yes. And clues can be concomitant cervical lymphadenopathy and previous pulmonary TB. Second T is for trauma. So is this pericarditis due to surgery? And clues there would be a patient who has a sternotomy scar or even post-myocardial infarct in the way of the infamous Dressler syndrome. T can also stand for tumor. So is this indeed a paraneoplastic manifestation of a cancer? So maybe it's a primary cancer of the pericardium, not very likely. It could be secondary, or it could be a paraneoplastic manifestation. Therapy in terms of radiotherapy. So radiotherapy can also cause pericarditis, and clues there clinically is, does the patient have any radiotherapy tattoos or a thoracotomy scar? The last T is for tissue. So is this a connective tissue disease? And big clues there to look out for is, does the patient have things like rheumatoid hands or stigmata of SLE, like any of the cutaneous features of lupus? Any concomitant synovitis or hemoproteinuria on the dipstick or pleural effusion, etc. Alright guys, so there you have it, the 5 most common causes of pericardial disease in our clinical setting: TB, trauma, tumor, radiotherapy, and connective tissue disease. God bless you and have a wonderful eve of Christmas Eve. I'll see you tomorrow with another hearty mnemonic in cardiology. God bless you.